So in the vitreoretinal clinic, we often treat patients with intraocular injections or eye injections. Another name for it is intravitreal injections. The most common conditions that we treat with these injections include macular degeneration, diabetic retinopathy, and retinal vein occlusions. So having an injection in your eye, I know it sounds bad, but it's not nearly as bad as it sounds for 99% of patients. The way it works, I'm going to show you a model of the eye. This is the front of the eye, and this is as if you could look into the middle of the eye. The retina is like the wallpaper in the back of the eye, and in the middle of the eye is actually a clear gel called vitreous. And when we do an injection, we use a very small needle to inject through the wall of the eye into the gel in the middle, the vitreous gel, which is why we call it an intravitreal injection. The experience of having an injection in the eye is not nearly as bad as it sounds. A patient comes to the clinic to have an intravitreal injection. We seat them in a regular exam chair. We sit them back, make them comfortable, put some eye drops in their eye to start the anesthetic. After that, we do a very small injection of an anesthetic, numbing medication on the surface of the eye, and we let that sit for a few minutes. And while that can be slightly uncomfortable, most patients tolerate that very well. It allows the eye to be numb for the rest of the procedure. After a few minutes of waiting, your surgeon will come back into the room and prepare the eye for the injection. This includes putting in a few drops of betadine. Betadine is an antiseptic. It's what we use when we do surgeries, and we actually use that in the eye during the injections as well. Now, because betadine is basically a soap, it works to remove bacteria and organisms from the surface of the eye, but it's also an irritant, so it feels a bit like getting shampoo in your eye. And so that's usually the worst part of the procedure. After that's done, we have the patient look down into the side, away from the needle, and we use a very tiny needle to inject through the white of the eye into the gel in the middle of the eye. Usually patients say, "Oh, are you done?" The vast majority of people after their first injection realize, "Oh, it's not nearly as bad as I thought it was going to be."